Hello and welcome to Coproduce Care, #Chat for Care. My name is Sophie Chester-Glynn and I'm the director at Coproduce Care Community Interest Company. And for those of you who don't know Coproduce Care, I'm sure a few of you have been joining into many of our live streams over the last couple of months. But we are a non-profit organisation which I started up end of last year. And the whole idea is to democratise the care debate. So opening up the nuanced care debate to everybody. So everyone gets a voice. It's not just 10-minute snippets you might see on regular media. It's more in-depth conversations about social care. And I wear another hat. I'm a care provider as well. So I do come to it with a bit of knowledge myself. But we're made up of a few volunteers and people who work in social care. So we're just trying to have casual debates about social care and have more people talking and understanding about it. So if you are joining us for the first time, then bring along anybody that you know who might want to join in the debate. We're very sort of like casual. We want people to come in and chat with us, have some comments. We had a fantastic debate last night, talking to two registered managers. So we talked about everything from workforce to training to funding. And we even had one registered manager play the ukulele at the end of it. So you just don't know what you're going to end up with Co-Produce Care Chats. So tonight I am really excited to have Liz Kendall, MP, Shadow Minister for Social Care, for care really, health and social care. And she's obviously a member of the Labour Party. She's going to be talking to us about a whole host of issues around the current social care debate, especially because, you know, we do talk mostly about social care on here. So really looking forward to talking to Liz. So if you've got your questions, I know some people have posted in some questions from Twitter earlier in the day. So we've got a list of those. We're going to be sharing those and we're going to be talking to those as well. So without any further ado, I'm going to welcome Liz into the live stream. Hello, Liz.
Hi. Hello, everyone. Thanks for joining us.
Thank you for joining us. I know you must be incredibly busy at the moment. How are you coping in lockdown or coming out of lockdown now?
Well, you know, I'm very lucky. I've got my job, all my team have got their job. It's been, you know, as a local MP, which is basically, you know, is my job. I know I have a national role, but as a local MP, you know, there've been so many issues that people have been worried about and contacting me for help with. And, you know, thanks to my brilliant team, we've done as much as we can to help people. And I think now, you know, as we begin, as some people, not social care, but I think as people begin to emerge from the virus, I think the schools have obviously been a big issue now, but it's going to really, really turn to the economy. And that is what I think I have such a long-term worry about, is people losing their jobs and businesses closing and the impact that that can have on people's lives. So, you know, whilst my national job is social care, as a local MP, you know, I'm very involved in all sorts of other things. I've got a Zoom tomorrow with local businesses to see what I might be able to do to help. I'm speaking to my schools because I'm very worried about disadvantaged children falling behind, as well as all the health and social care stuff I do. So we've been very, very busy.
Yeah, and so it's mainly social care that your brief is, rather than the health side anyway. Okay, good. That's good because we've got all the social care questions today, so it's all right. So I wanted to start off, I do want to ask about what kind of issues are coming your way from your constituents, but actually I want to start off a little bit high level and going to think about the role of opposition right now during COVID. And I know that Keir Starmer, right at the beginning, was saying that so Labour want to work with the Prime Minister, want to work with the government to try and think of a solution and fight COVID-19. But I want to take a little bit of a detour back a few years to a carpool that you had. I don't know if you remember this, but I'll put it up.
A powerful opposition actually calls the government out on the mistakes they're making, the fact that the reality doesn't match their rhetoric on their incompetence, but also sets out a credible alternative. I think a lot of people are fed up with pretty much most politicians and politics as a whole, and they don't just want to see you opposed for the sake of it, but they do want to see you hold the government to account, and do that in a really strong and confident way.
So that was 4 years ago.
You need a haircut.
Tell me about it. That's why I got my hair up today. But so what is the role? I mean, this is a difficult situation, really, because you want to be in opposition, you want to challenge, but then you also want to have a cross-party approach to COVID. So what is the role of the opposition government now?
So at the moment, and I think this can be hard sometimes for Labour members and sometimes Labour supporters who want us to give, the government a real kicking. I feel angry and passionate about what's happened and mistakes I think that have been made. But I want the government to succeed. I want them to save lives. I want to get rid of all the infection and death rates in social care. I want to make sure care workers are properly protected and have got the PPE and the testing. I want to make sure family carers aren't just excluded from the whole debate. I want to make sure that working age people with disabilities, we think about them, not just elderly people. So I want them to succeed, and I am doing everything I can. I write with my ideas. I've written a letter to Hancock today about what I think the sort of sustainable plan for social care needs to be for the remainder of the virus, as well as the longer term reforms we need. I have weekly, or they were weekly, they're now fortnightly meetings with the care minister, and I tell her what I'm hearing, I tell her what the problems are, I give her my ideas, I put forward solutions, because I don't want people to die. I want people to be safe. And if I don't care. If I come up with something good, I want them to do it. So it's different. But that doesn't mean to say I don't call them out when I think they've been doing things wrong. But I think it's also, that the Labour Party has lost the last 3 elections. We need to try and rebuild credibility and trust. And although people will understand when you're criticising or making suggestions to the government about where they've gone wrong, people want to say, well, what would you do? And so I'm always trying to say, okay, if this is a problem, what would I do? If this is a problem, what would I do? Because then I think people might, start to feel that we're credible. And and that's very important to me, because I don't want to be in opposition.
Yes, absolutely. You want to be across the other side.
I want to be government.
Exactly. And that's a really good segue to what we wanted to talk about next. And that's your 6 points that you put across. So I think it was, when is this? April, that you set out 6 key areas to address COVID-19 crisis, which is great, because actually we've kind of put them together here, and some of them have actually come through now anyway. So some of them around PPE, around testing, and I wanted to ask a bit about the chief care officer. What kind of role would that person, because that's something that we haven't seen yet, but what was your idea on that?
So I think there isn't the leadership on social care that's needed in the Department of Health. We're always seeing the chief medical officer, the chief nursing officer. Good, they need to be there. But I think that would help provide the professional lead and focus in the department that is desperately required. I think that, this virus has brutally exposed sort of longer term problems and flaws in the system. One of which is that, social care has always been seen as a sort of second class to the NHS. They're not treated equally. and they're not getting the priority and focus. And I believe a chief care officer would be one way in which there would be greater status for social care, that there would always be somebody who's got a seat at the table. And that's what I think is deserved. But that's just one of many things that we need to see change. And what I hope is that, you know, I think we need some immediate changes so that social care can deal with, in its broadest sense, deal with the remainder of this virus, but also push forward to the longer term changes and reforms we need, which, you know, I'm so glad to be on this call, because you cannot get the right policy or the right services unless the people who use them, their families and their care workers, create it. You know, that's been my experience, that the people who use services are the people who know best about what's wrong and what needs to change. And I think that is a very different way of thinking. You know, we've seen throughout this crisis a sort of government top-down approach, but for longer term reforms, we really need to have a different way of making and policy and delivering those services. And we won't get that change unless users and their families and communities are at the heart of it. I mean, I could say I think there's some positive things out of this crisis, but I will try and shut up for a little while.
Yeah, that's fine. I mean, I do have, as one of the things I want to discuss after I've brought in some questions from people, is the future of social care and what it looks like and how we do it, and the whole integration piece, because you've actually spoken before about the need to see social care and health as one, and I definitely want to come to that, but we'll hold fire. That'll make people stay to continue watching. We will come back, because I think that is the meaty thing. The way that we're working at the moment is changing, and it's COVID has massively exposed some of the things that you've been talking about for years, and that's about the need to see a person as a person. Then the system goes around that, so you think, hey, that person needs health and they need social care when they come out of hospital, and all of that piece. So I think let's delve deeper into that in a bit. I wanted to go on next to care homes and care homes deaths. And I know that another piece that you talked about is seeing the other services of social care, which is not just care homes, but seeing that we're coming out of lockdown now, that people are being more relaxed. It's Father's Day coming up. People are going to be mingling a bit more. I know in the social care home sort of sphere, everyone's a little bit nervy about that so-called second wave. And also just for a moment, revisit some of the figures that came from the ONS earlier this month.
Really, the striking thing here is care homes, and have a look at this line for the number of people who have died in care homes above the seasonal average. And you can see not only did it peak after hospitals, it peaked higher. So you have more people dying in care homes. And I should say this is for all of Great Britain. It doesn't include Northern Ireland, but it does include Scotland. And it's come down now. And if you look at the far right-hand side in that kind of that blue bit there, you can see that both in care homes and indeed in domestic settings, there are more deaths than normal, even at this late stage in the disease.
So do you think there's anything we should be doing now, or the government should be doing now, to sort of support care homes to cope better if there is a second wave?
So we've got to move from a one-off set of tests for care home workers to weekly testing, both of those with symptoms and without symptoms. Same for residents. I personally think we need to very quickly move to the point where we're also testing and providing PPE for families, because no one's been able to visit for months. And there are real concerns that a lot of people, you know, especially those with dementia, are going downhill fast, because, you know, if dementia is if you lose your memory, and so your family has your memory, and therefore they help to stimulate and keep you going and keep you as good as you can be. And without families, I'm not saying that care home staff, many of them don't do a really great job, but they just don't have the same knowledge as families. Care homes need to get proper support from the NHS. I've had a constituent issue just this week about a care home not being able to get any GPs to say that the residents can be registered. They'll start visiting them or being registered with them again. There needs to be, I think, a real focus on recruitment and retention. I'm concerned that a lot of staff have seen really traumatic, awful things. In some care homes where 10, 12, 14 people have died, very traumatic. So there needs to be mental health support. We need to have a proper recruitment and retention strategy in place. And I'm sure we'll come on to the issues around pay, but in particular, two groups that have not been talked about in terms of the staff are, there's always problems recruiting nurses into care homes. There's been a big increase in the number of people who are putting themselves forward to be nurses within the NHS. We need the NHS to share some of those and say, actually, being a nurse in a care home is very good, but also care managers. We talk a lot about the very, very front line, and rightly so. But when I was talking to Skills for Care just this week, they said they're very worried about the sort of care managers who are just utterly burnt out by the responsibility and stress. So you rightly said there, social care isn't just about care homes, it's about care in people's own homes, it's about personal assistants employed by people on direct payments. But there's still more, I think, because care homes aren't going to be out of this crisis for quite a while, and they need a proper package of support that lasts.
At last. And it's so fortunate that you mentioned registered managers, because we had 2 registered managers on yesterday.
Really?
And loads of people tuned in to watch them because they're quite big on social media. And one of them, Mark Tops, who's working with Skills for Care, and he's also giving evidence to the Health and Social Care Select Committee. So he might, you'll probably come across him at some point. And Jonathan Cunningham. And what I think it was Mark that mentioned the well-being of registered managers. And I said to him, what's the main issue? And he said loneliness, because, and I see it a lot in our sector, it's that kind of imposter syndrome you have. You're supposed to be the one that knows all the guidance, knows all the changes, supports the staff. So many issues coming up. BAME staff we'll talk about later, but there's a lot on registered managers, and they definitely aren't talked about because they are the people who need to know the employment law, health and safety, CQC, Care Act, Mental Care Capacity Act. There's a whole heap of pressures on them, plus COVID. On a normal day, it's tough. So it's great that you're speaking to Skills for Care, because we also had Una Smith on a couple of weeks ago.
I thought she was, really, really on it, and wants to make sure that there's much greater understanding about the whole range of staff who work in social care. We know the vacancy rate before COVID was over 120,000. I'm seeing some stuff in the chat here. Am I allowed to?
You are, absolutely. Go ahead.
Kerry Stevenson talking about the lack of coordination in testing care home staff. Some of them, they have the test and they don't get the result back, failing to collect samples. There's been a huge mess here with them not getting enough tests, delays in getting them back, void results, not being able to arrange their own pickup times. So a lot of that, has happened. The government says they're trying to put that right, but we're only just seeing, for example, care workers in homes for those under 65 being able to access the portal, let alone home care staff and personal assistants, as you know, employed by people on direct payments. They've not been able to get on the system at all. So it's just this kind of lack of knowledge about what social care really is.
Absolutely. And it must be so frustrating because one of my colleagues said, you've been writing about health and social care like since you came out of uni. And so you've got a lot of knowledge about it, where some people might not, who are in government, who are making decisions, and it seems like they're learning on the job, and that already puts us on a back footing in a crisis like this. So I wanted to move on to another part of care, which is carers, and Kerry mentions it, but we had a lot of questions around carers that came up on social media, and one person alerted me to this. Here we are. So the fact that the COVID-19 pandemic has seen that there are so many more unpaid carers than there were before. So there's like 13.6 million on this estimate. And I was talking to a colleague earlier today, and they were pointing out that a lot of care homes are seeing that their occupancy rate is falling, and those people haven't gone anywhere. They must be being cared by unpaid carers. So what support do you think unpaid carers need at the moment?
Well, you've got the new 4.5 million people who have taken on caring responsibilities. You know, that's 3 times as big as the NHS workforce. It's huge. And the existing carers, Carers UK did a survey and found that existing carers, 70% of them had taken on an extra 10 hours caring a week. I mean, that's massive. So they have struggled to get information and advice about what support's available. They've not been able to get in the supermarket queues to get a slot. There's no respite breaks. How can they have respite breaks? They've not had their own mental health needs assessed, because a lot of them, it's really, really stressful. And one of the things I did a Zoom for Carers Week, and they said the stress, if you're caring for somebody who is shielding, what are you going to do? Are you going to move in if you don't live there? Making difficult decisions. For example, today I was speaking to Shared Lives. I don't know if you know them. I absolutely love Shared Lives. They are the most uplifting, amazing, make me think everything in life is possible group. And, you know, one was talking about the person she was caring for who had a learning disability. She said, I decided I was going to take him outside because the impact of him being inside on his mental health and his general well-being, she decided that wasn't the best thing for him. So there are so many things that need to change for carers, the finances and financial support they get. And the thing that I'm really passionate about, because I think it's part of a longer term change in society, is unpaid family carers who are also trying to hold down a job. Because we know already around 1 in 3 carers have to give up their job because they can't get the support they need to do their caring. So they lose their income. You know, the Treasury loses their taxes. It's not good for their mental health, and the businesses lose their skills. And so I think that, you know, modern family life, women like, I mean, touch wood, my parents are okay, but women like me in their late 40s, almost 50s, taking on caring responsibilities, giving up work, you know, we have to say modern family life requires flexible working for carers. It requires a decent care system so people don't have to choose between holding down their job and looking after the people they love. And bear with me on this analogy, but I remember 25 years ago, you know, the arguments about childcare. We needed childcare so women could carry on working and because it was good for kids. And that it was as much part of the economic infrastructure as the roads and the railways. I think we have to argue the same on social care, which is don't just talk about the costs of social care, talk about the costs of not providing it, which is that families can't cope and they have to give up work. We wouldn't accept 1 in 3 parents having to give up work because they had kids. Why should we accept 1 in 3 family carers having to give up work because they can't get a decent social care to support their elderly or disabled loved ones? So that is it's a big thing about family life is changing. We're all, you know, working for longer and living for longer, and we've got to wake up to that. Otherwise, it's bad for our economy as well as bad for people.
Absolutely. And one person asked on Twitter, have you asked the Chancellor why he has not increased carers allowance when he increased universal credit and other benefits, and carers workload has increased to 24/7? And they say that the ONS says we save the country £60 billion. That was from one tweet. And similarly, someone else was saying that what plans are there for the UK Labour to support unpaid carers with meaningful actions following Carers Week? And they're just saying that they're really that carers are really struggling and a fragile frontline on the edge. So I suppose it's just Labour's plans for suggesting what should change for carers.
So in the letter I wrote Matt Hancock about the immediate changes we need to see as people are still dealing with COVID and its consequences, as well as the longer term reforms, one of the 5 areas I absolutely focused on was more support for family carers. And all of the things I've just said about the information advice, the respite breaks, flexible working, that the NHS has got to acknowledge that families may have mental health and stress needs after this. So it's about understanding that the vast majority of care in this country is provided by families.
Yeah.
I mean, the carers said, we've not heard once anyone clap for us, and obviously I believe that clapping outside your house every Thursday needs to turn into action. It's got to turn into a pay rise for paid carers, but I would also like to see more support for family carers too.
Yeah, absolutely. And I think it's a really bizarre situation where we have to come through rewarding work that is traditionally done by women. We have to come at it from a financial point of view in order to make a case that type of work should be paid for, should be monetized. And it's really weird. I've actually got this book, and this talks about it a lot, propping up my mic. And it's The Autonomy Myth by Martha Feynman, and I've talked about it. Where is it? There we are. Before, and this is quite old, and it talks about that point that women do so much work, and social care is predominantly women. It's not all, but it is predominantly, and we have to fight for the right to get paid for that type of work. Do you find that bizarre?
Well, no, because sadly some things never change, which is that things that are traditionally seen as women's jobs, women's work, is often either not paid or low paid. I'm a feminist, and I believe the same has been true on so many different, anything that's caring is seen as low skill, low value, is what women do. And I've spent my professional life trying to fight that.
Absolutely. So before we go on to the future of care, and there's so many issues within that even, I just wanted to touch on the Public Health England report that was done looking at the disproportionate effect that COVID-19 is having on non-white groups. And I know there was a lot of frustration that report didn't come with recommendations. Then it was released, I think, yesterday, that there was more detail behind it. And just wanted to play a clip from Yvonne Coghill, who very heavily involved in the workforce race equality standard under the NHS, and her thoughts on that, just very quickly.
We have 5 years worth of data in our NHS showing us very clearly that if you're from a Black and minority ethnic background and you work in the NHS, your experiences are worse than your white counterparts. And that's across the board. So things like if you are looking at recruitment, if you're looking at disciplinaries, if you're looking at going on non-mandatory training, your experiences are much worse than your white counterparts. So I'm not surprised that we have what we have in terms of COVID.
Do you think that, what do you think should be done now to support? Because I know from a very practical point of view, care managers are thinking, what if all our staff who are non-white say, we want extra protections or we don't want to work because we're really worried, but nobody in local authority is really having those conversations with us? What do you think Labour could kind of lobby for on our behalf?
This is absolutely essential, and again, I have, seen it in my own constituency where a care manager actually said that they were concerned about the increased risk for their care staff. So I said, could I speak with them? What did, just to hear directly if people were worried, and would she, the care manager, feel able to speak out about it? Because, my job is to give people a voice if they don't have it, but I would always rather people use their own voices. But she didn't want to risk it. She thought it might be bad, stop people coming to the home. She'd get in trouble with their bosses. So there's a whole set of issues, I think, about whistleblowing and giving people the I'd like to see more people, members of trade unions, because that's what they're there for. But I think there's a serious issue here about staff being able to speak out. Again, one of the issues in the letter I've written to Matt Hancock today, and just in case anyone is interested, it's on Twitter. I've done a thread about it. One of the workforce issues I put absolutely at the heart of that is that there has to be specific recommendations and support around for BAME care workers. I'm also actually concerned yesterday, was it yesterday? I've lost track of all the days. The CQC published evidence of the increased risk, whilst the overall there were far more white people who died in care homes and social care more generally. There was a much higher risk for BAME and Asian residents too. So this has got to be central. And one of the things I am concerned about is I think there's a new SAGE, the scientific advisory body, specifically set up to look at social care. I haven't seen any of their workings, what they're looking at, who's on it, what's the evidence. And that really needs to urgently be published. And there needs to be a strategy put in place to give people the confidence that they need.
Yeah, absolutely. I mean, there was David Lammy on Radio 4 recently said we have so many reports on race inequality, and he listed them. And
all the recommendations, he said, we've had 120 on this, implement it. I heard that. Yeah, he was great, David.
And I just think that it feels from the outside, when I'm not in politics, I don't know huge amounts about it, but it feels like people are just kicking things in the long grass, a bit like the Green Paper. We're having to look at more evidence to show what we already know, and it's just nothing to say, right, this is what we need to do, this is what we need to look at. It's really bizarre. Do you find that frustration?
I mean, yes, I really do. Having worked in government myself, I know the great things about it and the dreadful things about it and the frustrating things about it. I think leadership matters. I think if you have a prime minister who says, I want a strategy to deliver this and you're going to do it for me, then it happens.
Right.
I really do. The leadership matters. I mean, good leaders know what they know and know what they don't know. They're not embarrassed to say, I haven't got the expertise on this, but I'll bring someone in. But what they do is set a priority and set a goal and make sure that it's delivered on. And they're confident enough to know if they haven't got the skills to do it. But what they do is set a priority. And I don't think the government has made these things. The Windrush recommendations, why haven't they been implemented? David's own report that he was asked to do, why hasn't that been implemented? Why doesn't someone care enough to say this has got to happen?
Yeah, absolutely. And I don't think with COVID, it's not going to go away. So if there aren't any recommendations, then it's going to be a real big issue because it's going to be so obvious. So, I mean, in terms of, I was going to ask this at the end, but what can people do? Can they come to you with ideas? Is it mainly your constituents? What's your influence to have a voice, to challenge things that the government's doing?
First of all, I love to, know, please don't assume someone like me. I mean, I do my best to keep on top of everything, but I don't always know everything that's going on. So if people have got issues they want to raise, they should bring them up with you, and you can send it to me. And that happens a lot, where I think, oh, I didn't know about that, you know, so that's helpful. I strongly recommend that if you've got concerns in your own patch, that you see your MP, because there is nothing as powerful, for me anyway, than a constituent who says, this is my problem. You know, because then as an MP, you know, it's not just another party having a go at you about X, Y, or Z. You've got someone who says, this is actually happening. So speak to your member of parliament. Absolutely. I mean, some of the most, I mean, really, so I was talking about shared lives earlier. I mean, it was when I met shared life carers in Leicester that I completely fell in love and thought, this is brilliant. This is the future. It's like that. It's care at home. It's a family. You know, what does everybody want? What do we all miss from this? I mean, I want to see my mum and dad, and I want a hug. I want to see my friends. You know, the things that's so important, and we don't often talk about that in politics. But that family support, and it was shared lives that, going back to my point I was trying to make, that really brought it home to me. The people they cared for, who, when they were in institutions, were in a bad place, but when they were looked after by someone who cared about them and knew them intimately in their own personal wants and desires and helped them achieve them, lo and behold, they were much better off. I spoke to one today, you know, after 25 years, he's now off insulin. 25 years he was on insulin. You know, and somebody else who had serious behavioural problems, now out 6 days a week working, because they're cared for by someone who knows them and helps them achieve what they want. You just can't achieve that in institutions. So tell your MP, and hopefully they'll become passionate about it.
Thank you. That's really great. And we are going to go on to the future now and what it looks like in engagement. And one of my questions was, because there was something on YouTube when you were talking about shared lives as the future. And I had a video podcast with Alex Fox before COVID. I think it might have been last year when we just started doing this. And he has a book out and he talks about the future of social care. And actually, how I know about social care is my mum started up a shared life scheme when I was 3.
Oh, wow.
So I've always been in a house up until my teens that looked after people with mental health and learning disabilities. So it was just always a very full, homely environment. So and it wasn't called shared lives, it was adult placement schemes then. But so I've always been a big fan of that type of way of doing care. So when you talk, I mean, obviously you're new to shared lives, but do you have a vision of social care in the future?
Well, I suppose, I don't know if you've heard, I'm sure you have, are involved with Social Care Future, which is their vision of social care, which is helping people to live the lives they want in the places they want with their families, friends and communities. That for me is what social care is about. Back in 2002, I wrote a book called From Welfare to Wellbeing, The Future of Social Care, which is not about the sort of the system we have now, which is people scrabbling around with 15 or 30-minute care visits. Don't get me wrong, people need help getting up, washed, dressed and fed, but social care is about so much more than that. So I think we have to start from a vision which is about helping individuals and families live the life they choose with the help and support they need, that's informal and formal. Because as I said, we rightly focus on the formal care services, but if we ignore the informal care, which is what people want if they can have it, you know, but it needs proper funding and support. So that's what I think the vision should look like, which supports the care, obviously users, but also the family carers. And that's a very different way. I mean, I think it's a very different vision from what we have now, which feels like a very reductive time and task, stretched, pressurized, no one's happy, no one's getting what they need. And this is why I said there are some positive things out of this awful virus. I mean, if I think in Leicester, the mutual aid groups that sprung up, people wanting to help, you know, delivering food. I mean, if you'd got a person who needed food, they could have something by the afternoon. We got it to them. Now, you could never have organised that through a public authority. It would never have been so quick. And I think but if we want those sorts of groups, you know, ringing up for a chat to stop isolation, that was one of the big things. I'm sure it has happened where you are. We've done in Leicester too. If you believe that that is what helps people live well and feel well, then I hope as we emerge from this that we will actually fund those kind of services. You know, talking about mutual aid support in the community isn't trying to sort of do the, you know, the Cameron big society where, you know, it was basically cut all the public services and make everyone else pick up the pieces. I'm not interested in that. But I think if you start from what people want, to live as great a life as they can, you'll be thinking as much about supporting informal services as formal services. The other thing I would say is we have got to shift towards prevention and early intervention. There are so many people who are just, that have unmet needs. They don't get the help till they're severely have requirements. And that isn't the way we want to be. We've got to get that shift towards prevention and early intervention.
These are all great things, but I feel like I've been here before when we're talking about the same things. I remember I was in my very early 20s, and I think it was a Labour government, and they were talking about prevention, and that needed to be the thing. And we're just the same high level. Would the real structural change be the better, again, high level integration of health and social care? And because your role has changed, you were Minister for Care and Older People, and now you're Minister for Care. So, I mean, is that a starting point where we're recognizing that care isn't just about older people? So do we need to, I mean, should your role be health and social care as well?
I mean, you can't get great services unless they're joined up. And the reason why I'm such a passionate advocate for, you know, co-production and really putting users and their families at the heart of it is that people who use care, they don't see their needs in different silos. They don't see health over here, social care over here, the welfare state and benefits over here, and work over there. They're like a person. So they're best at joining up their needs. Users are the best at getting the shift towards prevention, because they don't want to get worse when they know a bit of help, bit of shopping or whatever it is up front would help them live on their own. And they're actually, I find, users of services are the best at ensuring cost effectiveness, because they really hate seeing money wasted on stuff that doesn't do any good. So integration is important. But what I would say is the case for integration around older people is very, very strong. But for many working age people with disabilities, they're not sick. They're not ill. They just need support to them to live the independent life they choose. So I don't think integration is the sole solution. And I think we've got to remember that there are, you know, of course there's crossover, but, you know, many disabled people don't want it like run from the NHS. They're not ill, you know, so I think we have to think carefully about that.
Absolutely. And I think that is a risk when you see integration as the golden egg. That's what we want to strive towards, only to find out that it doesn't, one size doesn't fit all. And maybe the solution to that is what you were saying before around co-production, of actually finding out what the solutions should look like from the people who use services and work work out from there. How would that, you know, the thing I wonder about, obviously we talk about co-production, we've done podcasts about it. It's very detailed. It takes a lot of effort in order to kind of dismantle or to reconceptualize how we deliver care at the moment. What would a national engagement on the future for social care look like?
Well, I think you have to do, if you're doing national policies, have engagement. But I believe it starts. I believe in the politics of place, and I'd much rather think about the bottom up. You can't. You've got to do both. And the truth is, I think I've talked about co-production for years, and honestly, most politicians and journalists, they just cloud over. It just sounds waffly hippie, God knows what you're on about. It's just, they want a top down, we're going to do this. You say we want people themselves to develop policy. Why do they pay for you then? I mean, it's a very different, if you see it, it's brilliant, it works. And the only time I have ever really seen for health and care the services transformed is when it really has been led by the users, because everybody just drops their it's hard dropping your professional silo. It's hard, the reason you're a professional is you think you have a sort of unique body of knowledge, and that's your status, it's who you are. So to be told, well, actually somebody else's knowledge is equally valuable to you, I understand the difficulties there, but I don't believe you get lasting change unless that is just in the bone marrow of how you develop services. It's a good question, that how do we make it happen? Because I've got to, hold my hands up here, that what do we need to do differently to make this happen? Because if we're banging on with the same arguments for the next 10 years as we've been making for the last 20, we're going to end up in the same place.
Yeah.
So how do we need to argue this differently?
Yeah.
That's what I'm really struggling with, because we have an opportunity after this awful virus, because social care is up there, but it's not going to fall into our laps. And I worry that as all the attention moves off to the economy and unemployment and all of that, we'll be back in the shadows. We've got to think about how we argue this, and we arguing it in the best way? And I'm really grappling with this, so that's why I'm interested in people's views.
Great. And I think, a lot of people will be watching this back. Get that conversation going, get those views over to Liz. She's on Twitter, she's around. You can contact her with any ideas. But I think definitely when I was thinking about questions for this, I thought it's all well and good us talking about it, but how do we get this national engagement? I mean, we've tried, there are channels, that one of the things that we do is we help people to respond to consultations, whether it's on the Mental Capacity Act, Code of Practice, or whether it's on the Health and Social Care Select Committee on workforce. We try and get, we do polls with people. We had 400 people respond to a latest call out survey that we did, and that's great. But is that the way to do it? The jury's out on that for me as well.
Yeah,
I don't know.
I mean, how I would. So one of the things I'm thinking of doing in Leicester is actually, in my role as an MP, saying, okay, I am going to try and get the users of services, their families together, and all the rest of the system around it, and say, as we think about developing our recovery strategy and build back better, or a reset, or the new normal, or whatever cliche it is, why don't we start with this? And I think somehow that has got to be how you start your process. And I'm going to try and see if we can do that in Leicester, to say, what if we did start with people?
Yeah.
Not that they don't do it, but I think the old consultation is rubbish.
Right.
It's like, I mean, you've got to do it. The trouble is, you've got to put your views in, because you don't want anyone in the government saying, well, you never told us about X, Y, or Z. But actually, what I think is, you need the agencies locally to sign up to say, we're going to do a different sort of a process.
Yeah, absolutely. And I wonder whether there needs to be some kind of, do we need to scrap, I'm hesitating in saying this, do we need to scrap the green paper and start again? Do we need to say, right, we're not going to do this green paper on how we have it, which is focusing mainly on older people. We're going to do it across the board and see how we need to change social care, or have a commission for each area of social care. Or I feel like there needs to be an overall review. Like you're saying, you're starting from the person, so they may be in contact with lots of different.
The green paper could say that, though. The green paper could say that this is the model that we want to develop and deliver services. And quite frankly, the green paper needs to sort out the money.
Yeah.
I mean, it does. And the government needs to, actually come up with a future funding strategy. I think the green paper could talk about, I hope it will have co-production at its heart. That's what, the government's got to signal, this is how we believe we get the best services and support. But the government's responsibility is to determine how these are funded. And that has got to happen. I'm slightly worrying that there's, backing off from producing it this year. I think that would be a mistake. I think it would be a mistake because I think we have to argue that a recovery plan for social care is integral to the country's recovery plan. Because if we don't get social care right, we're not going to be able to help families. We have to see it as part of the country's wider recovery. It's not like a thing off there. It's not like, just the care. This has been the problem with care homes, they're just off there, out of sight, out of mind. We're ignoring them. So I think, I think we need to have a direction which puts, if you had a government green paper which said, uses families co-production is the basis on which we'll develop and deliver these models, families in the community, at home, I think that would give a strong signal of the direction of travel.
Yeah. And just another question now. Finally, we're going on to workforce. So Chris has brought up the question about workforce development. We did touch on it with registered managers, pay and conditions. Now, I feel like I've heard you talk before about a living wage for care workers.
Minimum, an actual living wage.
Yeah.
But obviously, I want to see us move towards greater parity with the NHS. I think that has to include, a real rethink about training, professional development. I do think we need to look at what some other countries do, where health and care workforce, it's much, much greater parity in terms of that workforce, that you could work in either, and that the value and the pay and the terms and conditions are there. I'm very worried about, we've got over a half of all home care workers on 0 hours contracts, big vacancy rates. And so I think there's a whole piece of work that needs to be done there. If you really want to treat care workers equally, that's got to mean something in practice. And again, the letter I've written to Hancock today talks about these very issues, Chris. And I hope that they do this in conjunction with care staff themselves.
Absolutely. And I think that on the point of, again, co-production, and a lot of people say they're doing co-production and they're actually just doing consultations. So maybe a discussion about co-production needs to be set out like some kind of charter of this is where we're starting from. I don't know if you've heard of Think Local, Act Personal. They've done some work. Yes. So we've had a couple of people, a carer actually, Sally and Isaac, who receives care services, and they talked about their experiences, and hopefully we'll have some more people from TLAP on to talk about co-production, because that, again, like you say, when I first heard the word, I thought, what is this, another buzzword? But when you really look into it, it's more of a mindset change, culture change.
It is, and I don't doubt that it's I don't expect anyone to give any sympathy for politicians, but I understand, on the media side, they want an answer from you, and you saying, well, we need to develop the answers together, they just think is wishy-washy rubbish. So how if I announced Labour's policy is co-production, they'd be like this. So, but I really believe in it. but I just think we have to think about how we argue it and make it come to life.
Great. Okay, that's fantastic. And I think that's a great point to end on. So thank you so much for joining us, Liz. You must be so ridiculously busy at the moment. So we're very lucky to have you on our Co-Produce Care Chat for Care for a full hour. So thank you so
I'm lucky
much.
you invited me because, you know, being shut off in some room and not talking to people, I would not be living up to my ideals of what I believe in around co-production. So talking to you and listening to you. And what I would say is if you don't mind, Sophie, if people have more thoughts that they want to send them through to you and you can collate them and send them through to me, I would really love to read them.
Brilliant. Well, I'll let you go and then I'll talk a bit more about how people can do that. So thank you very much, Liz. Take care.
Thank you.
Great. So that was Liz Kendall talking to us about so much. I felt like we got through a heap of stuff. A lot of it, questions brought in before earlier today on Twitter. But as she said, if you've got any other issues, we are, of course, always happy to funnel those through. So do keep in touch with us. At CoProCare is our Twitter handle. We've got some fantastic interviews coming up again next week. We're going to be looking at in more detail the issue of Black mental health, social workers, and we're going to be talking to a lecturer at Goldsmiths University, and Sharon Jennings is going to be talking to us. But also we're going to have somebody who is a student and is very interested in the kind of psychology of mental health for students who are studying in areas of health and social care. So Yannick is going to be joining us from Bristol University, and I'm hoping to get another student on to talk about post-colonial studies that they're doing. Fingers crossed if I can get someone. So it might be a longer session next Wednesday, but do stay in touch because we're trying to contextualize and also provide solutions, those solutions that we don't have at the moment on how to support non-white groups who are working in health and social care. So we want to do a bit more of a deeper dive into that. So do, of course, follow us, Twitter. If you're watching on YouTube, please do subscribe and click on the bell if you want to hear more information about when we're going to go live. And Facebook, we've got our Facebook page, like that, and just keep in touch with what we're doing. And we really want to drive more people to the channel, so share and all that. So thank you everyone for joining us tonight. I hope you found it useful. Please let your colleagues, let your friends know what we're doing. People can listen back to these interviews whenever they want to. So thank you for tuning in, and we'll see you next week. Take care.